work your abs, you guys, but I want to let you know that these are not abs that you and I grew up in gym class doing a bunch of sit-ups. The abs that we look at, you guys, are the outer abs that connect from your rib cage down to your pelvis. And the abs that you and I grew up with doing a bunch of sit-ups are a muscle called your rectus abdominis muscle. And in our clinic, we want the same abs that they want in Pilates or yoga, which are your outer abs that connect from your rib cage down to your pelvis. And those abs with your pelvis help you to kind of tuck your bottom. That works your lower abs. These are really important if you've had a C-section. And your upper abs and the upper part of that muscle helps to pull your ribs down and in. So when we work on abs in our clinic, we will always have you tuck your butt slightly to help engage the lower abs. Guess what? You're not going to tell me what a great ab workout I gave you, because those muscles are worked out of a different muscle fiber. So you're going to feel tension, but not a big burn. But it's really important in our clinic, if you put your hands on your lower rib cage, and if you took a breath of air in through your nose and blew out through your mouth, your ribs should move down and in towards your pelvis. So if I take a breath of air in through my nose, see my ribs move down. See how they move down and in? If your ribs don't move, pause this video and go get a straw. Because when you breathe in through your nose and you blow out through the smaller diameter of the straw is going to allow you to take a more forceful breath of air out, which is going to maximize your ability to pull your ribs down and in. Hint, hint, why we have people blow up balloons at our clinic. It's not to make you feel weird. I don't want you to blow up a balloon right now, though, because I don't know. And in social media universe, I don't want to do anything to hurt anybody before I make you blow up a balloon. I want to make sure you have the correct stability in order to be able to do that. I don't want to hurt anybody, but a straw is pretty safe. So one technique that we like to have people do is you can take two hard-covered books and you can put both of your feet up on the hard-covered books with your feet hip-width apart. I don't want your feet to touch. So you need to have your feet apart. If your knees like to roll out or collapse in, maybe put a ball between your knees or a rolled up towel or a roll of toilet paper. What I want you to do first is let's engage your lower abs. You're not going to feel your abs turn on, but you will feel the muscles on the back of your thigh turn on if I'm going to get your lower abs to engage. So I want you to take a breath of air in through your nose. As you blow out through your straw or through your mouth and your ribs are moving down, I want you to roll your pubic bone towards your head as your ribs come towards your pubic bone. So you guys see I'm arching here, low back isn't here. You're going to exhale, push through your feet, especially your heels. You're going to roll your pubic bone towards your head and your ribs are going to go down towards your pubic bone. So this is going to come together. Your tailbone and your bottom should come up off your floor of your bed, but see how my low back is still on the bed? You don't want to lift up where your back comes off or you won't engage your core. You're going to use your back more, your glutes more. So you're going to tuck, tailbone comes up, ribs are going to come down, and now I want you to reach your arms up towards the ceiling. I want you to take a breath of air in through your nose. As you blow out through your mouth, your straw, I want you to reach so your shoulder blades come up off the table. That's going to help get your ribs to come down and in more. When you take a breath of air in, you've got to hold tailbone butt up off the floor, shoulder blades up off the floor, hold that position. You're going to hold this for 4 to 5 breaths in through your nose and out through your mouth. If that's easy for you, you can make this more challenging by every time you inhale through your nose, you can reach your arms up and back. Exhale, hold this position. Inhale, move up and back. Exhale, hold the position. You should be feeling your core engage and the back of your thighs engage as you work your way up. If you work your way up and you lose your tuck and lose your ribs, you're not going to feel your core. But you should feel a tightening, kind of like a corset on the outside of your abs engage as you do this. Remember, during pregnancy, as the baby grew, your pelvis had to come forward, your ribs had to come up. During pregnancy as the baby's growing. That's why you get short of breath towards the end of the pregnancy. Like you can walk like 20 feet to the bathroom like, oh my gosh, I can't breathe. Because when your ribs come up, your breathing diaphragm can't breathe for you anymore. That's why that can create back pain and a side pain and some sciatica stuff. So after you have baby, whether you have a C-section or a vaginal delivery, it's going to be really important to get your outer abs to go from this position to kind of more of a neutral position in order to provide stability to your trunk and your pelvis. I hope that tip helped. Have a great day.